Hi, I'm Dr. Trace Curry. Welcome to our Pre-Op and Discharge Instructions module. Today we're going to learn a little bit about things you need to know before surgery and things that you need to adhere to afterwards in order to have a good outcome. First off, we work out of two facilities. The main one is Journey Light, which is our outpatient surgery center. It's located in the same building as our main office on the north side of Cincinnati. It's important to know that out-of-town patients cannot leave Cincinnati the evening of surgery if you're having a sleeve or a gastric bypass. So the surgery center will cover an overnight stay at the Wingate Inn, which is about a half a mile away, so you can recuperate there overnight and head home the next morning. Gastric band patients are allowed to go home regardless of the distance from the surgery center. The other facility we work from is Jewish Hospital, which is about 5 miles to the southeast of our main office. The address can be seen on the screen here, as well as the website if you need any further information about the hospital. All of our patients are on a pre-op diet prior to surgery. The duration of the pre-op diet is determined by your body mass index. This is very important. It's critical to a safe operation with a low complication rate, and our dietitians will teach you in detail about your pre-op diet for your specific body mass index. Patients who are diabetic, when they start the pre-op diet, will frequently see their sugars come down right away. To compensate for this, typically we will reduce your diabetes medications roughly by half of your normal dose, but just be sure if you are diabetic to discuss this with your provider at your consent visit to figure out a plan. Blood thinners have to be stopped prior to surgery. Most blood thinners are stopped 1 week prior, so if you take aspirin or Plavix or Mobic or one of those types of medications, please stop it 7 days prior to surgery, otherwise your surgery may have to be delayed. If you take a more complicated blood thinner like Coumadin or Eliquis, Pradaxa, or Xarelto, we need to take some special precautions before we stop your blood thinner, so please talk to a provider about this before you stop it. All over-the-counter anti-inflammatories except Tylenol are mild blood thinners, so you can't take any Motrin, ibuprofen, Aleve, or Naproxen for 7 days prior to your operation as well. Patients will need pre-admission testing prior to their procedure. This always consists of blood work and sometimes also an EKG. If you're having your procedure at Journey Light, you'll get your pre-admission testing done on the day of your surgical consent visit. Unless you're having your consent visit in Dayton or Columbus, then we need to make some different arrangements for your pre-admission testing. If you're having surgery at Jewish Hospital, you'll be contacted by the hospital to arrange your pre-admission testing. And as I mentioned earlier, everyone will get blood work, but not everyone needs an EKG. It depends on certain criteria. With regard to medications, on the day of surgery, you cannot have anything to eat or drink after midnight prior to your procedure. Unless otherwise instructed, you should hold all of your regular medications except medications for blood pressure. However, if the pre-op department or anesthesia tells you different, then follow their instructions, as ultimately their desires trump ours in terms of which medications they want you to take on the day of your procedure. After surgery, you'll get a list of which of your regular medications you need to resume. Pills can be swallowed as long as they're the same size or smaller than a regular M&M. If they're larger than that, they may need to be crushed. However, you can't crush all medications, so before you crush a medication, please check with your pharmacist to make sure that it's okay. You will get some post-op prescriptions when you leave your surgical consent visit. You should have at least 2. Typically, you'll get a pain medication and a nausea medication. If they are tablets, then we already know they're okay for you to swallow after surgery, so there's no concern there. We may prescribe blood thinners post-operatively for some patients, so a provider would discuss that with you if you need those. As far as your post-op vitamins go, we recommend that you just start your sublingual vitamin B12 on post-op day 7. So Sublingual means that you dissolve it under your tongue, you don't swallow it. As far as the other vitamins, we're not going to start those until you're instructed by one of our dietitians, so this can be discussed at your initial post-op visit. Let's talk a little bit about post-op pain. Obviously, after any operation, some pain is to be expected. You will have some pain from the small incisions, and also left shoulder and left neck pain is common. This is typically from irritation of the diaphragm, either from the operation itself or from the gas that we have to blow in there. We inflate your abdomen with carbon dioxide so that we can see around in there during the surgery. Aleve is very effective at helping with this pain. However, only band and sleeve patients can take Aleve. Bypass patients cannot take non-steroidal anti-inflammatories due to the risk of ulcer. Band patients will have pain near where the port site is located. Usually this is above and to the right of the belly button. You're going to feel a lump there, which is normal. Sometimes we get calls from patients after surgery and they want to know if it's normal to feel a lump there. And yes, it is, because that's where the port sits. As far as incision care goes, you can take the dressings off if they're still present when you go home from the hospital or the surgery center. Underneath the dressing, you'll see steri strips there, which are stuck right to the skin, and those are to stay on for 10 to 14 days. Once they start to peel up on the edges, you can peel them off one by one. You can take a shower when you get home, but no baths or swimming for at least 14 days after surgery. If you have any excessive drainage from your incision or redness that you feel like is getting worse, not better, please call and let us know. Typically, if you have any problems with your incisions, it's helpful to email a picture of the incisions to the email address you see on the screen there, provider@curryweightloss.com. That way we can make an assessment of whether it's significant enough that you need to come in and have us take a look at it. With regard to activity after surgery, no driving for at least 48 hours. You have to be off your prescription pain medications before you get behind the wheel. We recommend frequent short walks in order to get the blood flowing in your legs and prevent blood clots and pneumonia and things like that. With lifting, we recommend no lifting over 20 pounds for the first 2 weeks. In the third week, you can lift up to 30 pounds, and after the fourth week, no restrictions. You can resume light cardio at around the 14-day mark after surgery, typically either a walking regimen or even maybe on a treadmill or lightly on a cross trainer or elliptical. And the typical return to work is around 1 to 4 weeks. Obviously, it depends on your job. If you have a desk type job, 1 week may be fine. If you have a strenuous heavy lifting type job, you may need closer to 4 weeks. So please discuss this with your provider at the consent visit. Constipation is sometimes a problem after surgery, so let's talk a little bit about ways you can deal with that. If you already know you're prone to constipation, then we recommend that you just start Benefiber sugar-free powder right away after the procedure. Just read the package instructions and follow those. If you don't have any results within 5 days of starting your Benefiber, then you can add Milk of Magnesia, 2 tablespoons twice a day, and also continue your Benefiber. If you still don't have results 48 hours after that regimen starts, then you can add 2 Dulcolax tablets daily or over-the-counter Miralax. If you still don't have any results after that, then please call the office so we can formulate a plan. Bloating and gas is also common after laparoscopic surgery. Anesthesia and narcotics can slow your gut down. Walking helps this a lot, so again, we recommend short, frequent walks. Watch for any food trigger that might be causing bloating issues. If you notice after one specific food intake you get bloated, then avoid that food. Over-the-counter Mylicon or Gas-X. Gas-X comes in tablets and strips that you dissolve on your tongue. These are effective for this issue as well. And again, Aleve can help a lot with this, but it's not for bypass patients, only band or sleeve. Vomiting and dry heaving can occur after surgery. Obviously, use the medications that we prescribe to you if you have any nausea component involved with this. Assess how quickly you're eating or drinking. It's hard to get used to, especially after a sleeve, how slowly things will trickle through your stomach. So you really need to make sure you're going slowly. If you have some vomiting or dry heaving, we recommend waiting 4 hours. So don't put anything at all in your mouth for 4 hours, and then try just 1 ounce of a sugar-free liquid. If it stays down, then 15 minutes later or so, you can try another ounce of sugar-free liquid, and then keep moving along as tolerated. If you keep the liquids down, stay with liquids only for the next 24 hours. Even if you have already been on the pureed phase prior to that, it's best to do 24 hours of liquids before you go back to puree again. If it's persistent, or if you have any black or bloody or coffee ground appearing vomiting, then please call the office and discuss that with us. Just a quick word about pregnancy. It's very important for women to avoid getting pregnant for 18 months after any type of weight loss surgery. And it's also important to point out that fertility significantly increases with weight loss. So several times a year we get calls from patients who say they didn't think they could get pregnant, and they're 2 or 3 months out from surgery. Now they're pregnant. And this can be a very serious issue because in some cases, we can't stop patients from losing weight after surgery, and it's not healthy for the patient or for the baby. So we definitely recommend using a backup birth control method for the first month or 2 after surgery, as it can take a while for you to get regulated again with birth control pills and such. So please just be careful and take the appropriate precautions. For your follow-up appointments after surgery, we need you to come in for a post-op check within 7 to 14 days after your procedure. If you live more than an hour away from one of our office locations, we can do this by phone. Again, it will be helpful and actually necessary, if you're going to do this, to email a picture of your incisions to provider@curryweightloss.com so we can make sure those look all right, and then you can arrange a phone or a virtual video follow-up with one of our dietitians to discuss advancing your diet. We also recommend that you make an appointment with your primary care doctor to be seen around 2 weeks after surgery, especially if you take blood pressure medications or diabetes medications, so that they can help regulate these as your sugars come down and your blood pressure comes down as you lose the weight. For band patients, we do your first band adjustment 4 weeks after surgery. It's best to come to our Cincinnati location for that, because we have an x-ray machine there and we can do a better initial adjustment. But then for all the following band adjustments, you can go to the closest office location. The second band adjustment we do 4 weeks after the first, then the third one 5 weeks later, then the fourth one 6 weeks later. On the day of a band adjustment, we recommend no solid food. You can have liquids or pureed food, but please no solids. And then after any band adjustment, we recommend liquids for 24 hours, pureed food for the next 24 hours, and then as long as those stay down, you can go to solids on day 3. Let's talk about some situations that you might need to call us. We are there 24/7 for emergencies. You can always reach a provider from the office, typically either if it's after hours, myself, or one of the other physicians on staff. Please call us if you have any significant bleeding from the incisions, or if you're vomiting blood, or you notice any blood in your stool. Please call us if you have any signs of infection, if you have fever over 101.0, if you have redness, swelling, heat, or excess pain at any of your incision sites, and also if you have any drainage from the incision that looks like pus or has a foul odor. If you have any separating or opening of your incisions, please call us. If you have nausea or vomiting that's not relieved by your medications, call us. Call if you have pain that's not relieved by your medication. If you have new onset of calf pain or swelling in one leg only, then call us, because that could be a sign of a blood clot. And basically just use common sense. If you have any concern and something doesn't seem right, just give us a call so we can talk it over. Let's go through the diet progression for the operations real quick. For gastric band patients, it's pretty simple. Day 1, you just do clear liquids, things like water, broth, sugar-free Jello or popsicles, and Propel or G2. And then starting on day 2 and for the next 2 weeks, you can do pureed food. So this is anything that has no chunks in it, that's thicker than a liquid. After that, you can go on to soft solids as long as you're tolerating the pureed phase. And it's important to avoid carbonated beverages until you're instructed that it's okay from our dietitians. For sleeve and bypass patients, the phases are the same. They're just advanced along a little slower. So for the entire first week after surgery, you follow the clear liquid diet. So the same things I mentioned before: water, broth, sugar-free jello, and popsicles, Propel and G2. And then for the next 3 weeks after that, you follow the pureed phase. So anything that has no chunks in it that you don't have to chew. After that, starting week 4, you go on to soft solids. And again, you have to make sure that you're tolerating pureed food before you start soft solids. If you're not tolerating pureed, you're not going to tolerate soft solids. And again, no carbonated beverages until instructed by our dietitians. Many patients will need protein supplements after surgery, especially sleeve and bypass patients. And vitamins are also important after surgery. And I just want to point out that we carry only pharmaceutical grade vitamins. So the vitamins that you buy at GNC or at Kroger are typically not pharmaceutical grade, so they're not regulated in terms of the quality or the actual contents of what it says what it says is in there on the label. So all our vitamins that you see in the office, you can get on our e-store online, as well as our protein bars and protein shakes. You can just go to loseweightcincy.com or loseweightcebus.com or loseweightdayton.com, and then you can see the e-store call out in the mid-right portion of the page. Also, we like for our patients to stay up to date on what's going on in the office and see our announcements and our support group postings. So you can see those again on our website in the recent blog post section, or you can look on Facebook under facebook.com/Dr. Curry. So please keep up to date with the things that are going on. And I want to thank you for watching this video and paying attention. The PIN code that you need to know to tell the office is 1776. So please let them know that you watched the video and you know the PIN code, which is 1776. And good luck with your surgery. We'll see you soon.